Welcome to the August 18th Health and Human Services Board meeting. And I will call our meeting to order. Roll call, please.
Kathy Leaf. Present. Kara Koch.
Present.
Dave Osnes. Scotty Yard.
Present.
Greg Telejohn.
Present.
Paulette Anderson.
Present.
Deb Lindeman.
Present.
Natasha Ward. Present. Paul McGinnis.
Present.
Welcome, everyone. We do have a quorum. Next on the agenda will be the approval of the minutes. Anybody have any additions or corrections to the previous meeting? Seeing none, those will stand as written, and we will move into public comment. Remind folks that we will allow you 2 minutes to talk, and first up will be John Strom. John.
Dizziness, fatigue, and nausea. Many people have taken medication and shots for measles, smallpox, mumps, and all of a sudden, this is all political and infringing on freedom and political rights. What happened? I'm a science guy. Science is not able to help with the emotional issues. Science cannot overcome social media misinformation and disinformation. You folks have done a fantastic job using science to protect the residents of St. Croix County. It is interesting that so many people have no regard or interest in science anymore. They are tied up in a knot over wearing masks and avoiding the vaccine, though it would save their lives and the lives of their loved ones. I hope you are able to continue working to protect the residents of St. Croix County.
Thank you, John.
I will continue to cheer you up. Thank you.
Thank you. Beth?
Thank you for the time to speak. We keep hearing about the rise in cases of COVID. The CDC is pulling the PCR test off the shelves, claiming they are faulty. We can't trust the tests, so how can we trust the supposed case counts? How many of the positive cases over the last year and a half were incorrect? The test cannot detect if it's COVID or the flu, yet they are determined that it is COVID. There is no test to tell if you have the Delta variant unless there is extensive testing done in a lab. Yet we are supposed to trust the tests and numbers that are pushed down our throats. When is the false information going to stop being pushed on the community? You're using faulty tests to produce faulty numbers, which our local schools are using to the detriment of our kids. Masking for 8 hours a day, causing kids to have trouble meeting new friends, expressing themselves with facial cues, using the mask to hide behind instead of facing adversity head on. And this was all said by a local school counselor. Kids are not at severe risk, or are the spreaders. There is not one documented case in the United States of a student transmitting COVID to a teacher. Viruses will be around forever. Stop with the fear-mongering and instead promote healthy lifestyles. Food, exercise, vitamin D, vitamin C, zinc, hand washing, covering your face when you sneeze. Thank you.
Thank you. And Carol?
Hi, my name's Carol Ivans. I live at 613 Noah Drive in Hudson. My questions for you are about evidence and logic. The CDC and the WHO give us guidance on COVID, and pretty much everyone has blindly followed their suggestions as if they're logically binding and not questioned their science. Let's look at real numbers and percentages. In 2020, COVID was survived by over 98% of the population, and only the elderly and those with comorbidities got seriously ill or died. This is basically the same percentage in population that suffer every year from the flu, coincidentally or not. And the flu just disappeared last year. Over 98% of the population surviving is hardly an epidemic, much less a pandemic. Far more people committed suicide from the fallout of the overreaction to COVID than from COVID itself. So why the continued illogical, unscientific nonsense being shoved down our throats? It's way past time for you who supervise the health of this county to prove to us that masks and vaccines are effective, much less safe, especially for children. You could start by telling us who has actually isolated this virus. The last I heard, that still hasn't been done. Next, please prove that your tests are accurate. The inventor of the PCR test told us plainly that it's not designed to test for disease, and it isn't accurate. And as Beth just said, the CDC is now pulling it. Antibody tests could be positive because of herd immunity, not because someone's sick. Please stop feeding us test numbers. We don't care because they're based on inaccurate tests. Testing positive doesn't mean you're sick, and people are now dying from the vaccine, so stop conflating that with COVID. Just check the alarming number of deaths on VAERS from the vaccine, which are only a small percentage, not to mention the awful side effects thousands more are also suffering from. As for masks, compare Obama's maskless party with the projected numbers of people getting COVID at Sturgis, which are only projected and not true. No double standard there. As usual, if you follow the money, not the narrative, a very different picture emerges and the lies were being sold. Thankfully, many of us aren't buying it. Thank you.
Thank you. Is there anyone else wishing to make public comment?
Thank you for the opportunity to speak. My name is Crystal Coleman. I had most of the things written down by these two previous women, so I find it very funny and interesting that they must be studying and seeing the same kind of research that I am. This afternoon, I spent some time on the St. Croix County website in regards to the COVID-19 information that you have there. Under the COVID-19 vaccines, important and preventing the spread of variants, you have some information that I would like to clarify. The sentence that says, the vaccines currently authorized for use in the United States. They are not authorized, it's under emergency use authorization. Those are two very different things. The FDA has not actually approved full authorization of any of the vaccinations here in the United States. They are still going through clinical trials and will be until 2023. Now, emergency use authorization is something that is different, and therefore the reason why they were able to put that through in the United States is because they are trying to suppress the natural immunity that you could get once you had COVID, or by using natural health things such as vitamin D, vitamin C, getting fresh air, exercise, sunlight, and also HCQ and quercetin. Those are all great things that I would love to see this board take a look at and see what kind of things we can promote in our county to help us be able to do things other than just an emergency use vaccination. Now the CDC, they are an interesting bunch. You might want to follow the money and find out who are the biggest donors. It is not a government agency like many think. Some of the biggest donors for the CDC is Pfizer, the Bill Gates Foundation. Follow the money there. Where these emergency use authorizations for the vaccines came from, the people that are trying to put those vaccines on the market. So, thank you so much for your time.
Thank you. Is there anyone else that would like to make a comment? Seeing none, I will close the public comment and we will move into our business items. First item will be a summary of the current disease activity and vaccine distribution efforts. Is Ellie and Kelly on? Okay.
Here, we'll be loading the presentation and we can get started. Thank you to the board for having us on continuous updates related to COVID. I wish our news was better today. You can go on to the first slide, Ellie. Today, Ellie and I will run through our most recent public health update.
Kelly, hold on just a second. You're breaking up. Ken?
Oh, I am. How about now? Breaking up?
Just another second yet. Right now, Kelly.
Okay, how about now?
Kelly, you're very loud. Move away from your mic.
Loud and breaking up. Are we good? I'm going to start and you guys stop me if you cannot understand or if I'm too loud. Sorry, Scotty. We're going to go through our public health advisory. Ellie will talk about case activity and where we are at.
Kelly?
We will,
Kelly? Can you try something and turn your camera off and try speaking? I've had that issue before, and that's what I've had to do.
how's that? Is that better?
Yeah.
Yeah? Okay. We'll talk a little bit about public health, COVID reminders, as well as where we are at in St. Croix County related to our COVID response. And then Ellie will talk through Delta variant vaccine numbers, try to answer any of your questions related to COVID. And then we do want to do a plug for our community health needs assessment that we do with our hospital partners every 3 years. Am I still too loud? Okay, so our current public health advisory was issued on August 6th. There is a link to the advisory on this slide, and the slides will be shared with the board after we are done here tonight. This advisory really came out of the fact that CDC updated their guidance in late July related to current levels of community transmission across the whole United States. Many of the health departments in the state of Wisconsin are looking now at CDC's community transmission level to determine recommendations or health advisories. So what is different than what we were operating with summer is that this summer the CDC came out and said, if you are fully vaccinated, you need not wear a mask. With the rise of Delta variant, and Ellie will illustrate this. She has a very good slide that really illustrates how fast we have seen our cases go up. The CDC guidance now recommends that regardless of your vaccination status, if your community is in substantial or high transmission, everyone should be masked. Other entities and stakeholders within the community, there is universal masking policy recommendations. Healthcare settings are still masking all the time. Guidance for our schools did come out related to masking. A lot of this has to do with the population in our schools. Only about half of the kids who are in our schools are eligible for vaccines. So that is another reason why our schools are, the CDC has come out and said, better safe than sorry, universal masking for all in schools. So you can see the different categories. And we have been in high transmission for 2 weeks in St. Croix County. There was earlier in the summer, like I said, Ellie will show some slides later on that really illustrate how fast we moved to high. We were in moderate transmission level for parts of June and July, which was great and gave our staff a little bit of relief. We had 41 cases of COVID today. Next slide, Ali. So some of the public health reminders about COVID, because I know we are, I think, sensitized in public health as we are dealing with this still on a daily basis, where we know that it isn't on everyone's radar all day, every day, like it is in public health, but COVID is still here. It is still present in St. Croix County. The mitigation measures that we have is definitely number one, to control the spread of the disease. Vaccine is the best tool that we have to combat against control and the spread of COVID, along with other non-pharmaceutical interventions. We call these NPIs in public health. They include isolation and quarantine, which we are still responsible to do in public health, which falls under our contact tracing. So when positive cases are identified by entities that are testing, which I need to say, public health is not a tester. We do not test our residents or other residents in our community. These tests are done by our clinical and hospital partners, as well as pharmacy partners and any other testing sites that we currently don't have right now, like a state-driven site like the National Guard has done in the past 12 months. Masking continues to be, we believe, a huge barrier to prevent and control the spread of COVID-19. And we will see how this plays out in our schools this fall. We're going to have live research in the making this fall as the kids start back to school in the next couple of weeks. Social distancing, yes, staying home when you're sick, washing your hands, things like vitamin D and other remedies that were mentioned certainly don't hurt, but we need to absolutely follow what we are being told by CDC and follow the science as to these other things that we know do stop COVID. The other thing we really, really need is cooperation from the community. We understand people are over COVID. They've been over COVID for a significant amount of time. Unfortunately, COVID isn't sick of us, and it's still here. So asking for cooperation is the best thing you can do to stop this the case activity we've seen here in the recent weeks, as Ellie will point out in her slides to come. Some of the things internally that we're doing, I thought it would be good to mention that we have put a tiered approach in place. Internally, we had the good fortune to be able to hire LTEs last year. Since then, this summer, when we saw less cases, we did tell our LTEs, we may call you again when our cases rise. So right now, we're doing primarily all this work with 4 LTE people. And we have put a plan into place, a tiered approach, at how many cases, how many positive cases come in, determines what plan we will use. We have an A, B, and C plan. We've also utilized the crisis standards of care, which DHS has approved and sealed with trying to mitigate health departments who aren't staffed to try to get through the enormous cases. St. Croix County isn't an outlier. The state of Wisconsin are all seeing higher substantial case activity level with the exception of very few counties. We started reconvening or continued meetings with the following stakeholders. It was very interesting last week. It's about the third bullet down. The chief nursing officer group that is out of Polk, St. Croix, and Pierce counties checked in via email with each other and said, we'd really like to get our group back up and running related to bed counts, as they are seeing more hospitalizations, and they want to have that. If you remember last spring, we implemented it was a daily check-in for a while with our hospital partners related to regional bed counts, so they could look across the 3 counties versus having to look over across the river to Minnesota or to the Eau Claire area. So they asked for that last week, which I think says a lot about where we are at in terms of case activity level and overwhelming the healthcare system. Our hospital group continues to meet. That's comprised of various staff from hospitals of Health Partners, Alina, Western Wisconsin Health. So we're continuing to meet and check in related to all things COVID, whether it's testing, vaccines, as well as, like I mentioned, this bed count. Pierce County leads an infection prevention committee, which these are specific staff within our hospital settings whose role is to look at infection prevention. They have been tasked with a lot of things COVID related through this response. So we continue to bring the partners from all those health systems together to discuss different recommendations and what each of the clinic and hospital systems are seeing. Also, our school superintendents group continues to meet. We met through the entire summer, and our school nurses had their first meeting yesterday, followed by another meeting today, training how to use our system, in which we will do contact tracing for our schools. If you recall from last year, our schools took on a huge burden when we were so overwhelmed with cases, and they were able to do the contact tracing within their schools. They will not be doing that this year, so that will fall to public health. I feel like we have had all 6 districts represented throughout the summer meetings, and I think there is good relationships established to collaborate, and we will be able to get names of close contacts and positive cases. So I'm confident that the school year will it will be a smooth. It might be overwhelming for public health, but it will be a smooth process. I do want to just quickly talk about booster doses. I know there is a lot of information related to booster doses for those who are severely or moderately immunocompromised. We have discussed this probably for the last 4 days here at St. Croix County Public Health. This information came out Friday that the Immunization Council said, yes, we should approve booster doses for those with a weakened immune response. We are close to making a decision on whether or not we will implement those booster doses currently right now at St. Croix County. We have a lot of competing priorities, like 41 cases today. So we're still down staff. We have made 2 offers to fill our retirements for our nursing positions, but those staff have yet to start. So still a little lower on the staffing end, and really need to prioritize when we have healthcare systems and pharmacies in our community that are likely able to fill some gaps for us in the meantime. It's not a final decision that we wouldn't do booster doses in the future, but it's just kind of prioritizing and making that happen when the timing is a little bit better for public health. That's it for me, Ellie.
Ms. Kelly. Please let me know if my volume is too high or you can't hear me clearly. I'll just start in. So what you're looking at here is really what Kelly referred to as the progression of COVID-19 within the state of Wisconsin. The what these colors represent are down there at the bottom. So blue is the low, and it really looks at measuring the total new cases for 100,000 people in the past 7 days. You transition from blue to yellow to orange to red. And what we can see from July 19th to August 10th, in under a month, the entire state of Wisconsin has pretty much flipped from being in the yellow, the moderate transmission, to now being in the substantial and now predominantly in the high red transmission. This is the data that we are using for the mask advisory and our public health advisory that's found on our dashboard. And so this is really helping us judge how much COVID is circulating in our community and in the surrounding communities. As you can see, these maps from the CDC do offer every county and their transmission level across the US. So this is very dramatic. And now as I go to the next slide, I want you to see this is where the state of Wisconsin is now. So now it is almost a full majority with a select few counties not being in the high transmission. St. Croix County, as you can see there on the left-hand side of the state, is in its high transmission. As Kelly said, we've been there for the past 2 weeks. What does that look like on a day-to-day basis? On a day-to-day basis, as you can see, we're seeing about 20 cases a day. So this is a 7-day average. So as Kelly mentioned, we had an enormous amount of cases today. But with a 7-day average, we're seeing about 20 cases a day. The last time I presented to Health and Human Services, we were seeing 3 cases a day. So it has been a dramatic upswing of cases within the county. Where are we seeing those cases? So if we look at that graph there, across the bottom are the age groups, and then the bars indicate the number of new cases. So in May, school was still in session, and we were seeing the predominant number of cases in our 10 to 19-year-olds. Now in August, the blue bars, where we're seeing our cases is merely a direct reflection of, with the exception of the lowest age group, which we haven't had outbreaks in daycares yet, which did happen for us back when we were in a surge. But what we're seeing now is that the highest cases are being reflected in the groups that aren't vaccinated. And I'll show you those graphs later on. So where we're seeing them, you see the 30 to 39, the 20 to 29, our 40 to 49, and even our 10 to 19-year-olds. This is where the predominant number of cases came in so far in August. Just to give you that kind of the picture of knowing that we've had surges in the past, knowing we've had to update our health advisory, and knowing that we've really worked hard to control the spread within St. Croix County. We've had 2 major spikes, one in the November and one in April. And you can see us there at the far corner of the graph where we're starting that climb again. So as predictions have said, we are not done. We're not going to plateau. We are going to continue to climb. So it's more and more important that those mitigation efforts really be taken seriously because COVID, this current spike in our cases is really driven by the Delta variant. It is the dominant variant in Wisconsin. We know that because of the sequencing that has been done. That is a surveillance-based sequencing, and that is its purpose to alert us to what is going on in our state. How do we know that this spike is Delta? Well, Delta acts in a very different way than previous variants or even the original strain. So as you see there on that graphic, the original strain would infect one person, would infect about 2 people. Now with the Delta variant, each person has the possibility, or on average, is able to infect about 5 other people. So the extrapolation, that increase that we've seen in this month, that just dramatic shoot upward, that's what we're seeing. We're seeing more and more people infected and at a rapid pace. Just a couple notes on Delta. It has been in the news. People are talking about it. We know it's highly contagious. We know now with a couple of studies that infections with Delta are seen to be more severe. We actually hit a record across the United States earlier this week with the number of children being hospitalized for COVID at one time. It was over 4,000. And so this is a very concerning variant in how it's going to impact our population. The good thing though is that vaccines do prevent over 90% of severe disease. There is the discussion of breakthrough, but the risk of severe disease or death, it's actually reduced by tenfold by the number of cases that they've looked at if you are vaccinated. If you are vaccinated, you also have a threefold reduction in risk of infection. Why? Because Delta creates a greater viral load, means there's more virus within you. However, you have the vaccination, you have that ability to fight quicker, and that is taken down, as well as having the initial protection from being vaccinated. So yeah, like I said, that last bullet point there, they do appear to be infectious for a less time than the unvaccinated. So the risk of spread has lowered. Now, in terms of vaccinations, where are we? St. Croix County, as all residents, if you see, we are at 49.2%. We can see on the graph that starting at the 45-year-olds and upwards, we're seeing high. So the last two bars are 18 plus in our total population. But if we look from 35 on the age rate, 45 on the age range, we're seeing high numbers. Now the low numbers come in that 25 to 34 age range, which is exactly where we're seeing the most number of cases right now. Our youth are being vaccinated. These numbers continue to rise, especially with the onset of school and the risk of transmission. So that's encouraging. Every day we are moving a small amount closer and closer. St. Croix County is still offering the vaccine at the public health building. You can find more information on the website. And many of our local health partners as well are still offering the vaccine. Just a couple of updates, as Kelly mentioned, there is now a recommendation in the middle section there I'm going to focus on first. So there's a third dose for moderately to severely immunocompromised individuals. There is a set of conditions. Right now, please seek your healthcare provider. And then healthcare facilities may enact a tiered approach if they do have an overwhelming request for the third dose. A booster dose. This was released by the federal government. This has not been enacted by the Wisconsin Department of Health Services yet, but this is the beginning of a plan that they would offer a booster dose for those who are fully vaccinated with Pfizer or Moderna. They would do a tiered system. So like we had initially to receive the vaccine, those long-term care facilities and healthcare workers, they would be on the top of the tier. There was not a mention of the J&J. That vaccine did come out later than Pfizer and Moderna, but they do anticipate a need because Delta is just creating a whole new approach and requirements for our population and our community to really combat this disease. On the other side, on the left hand there, just so people are understanding, the CDC did now come out with a formal recommendation for pregnant people to get COVID-19. It always was recommended, but there is now even more evidence about the safety and effectiveness of the vaccine. And more evidence has been coming out about the adverse effects. So as you can see there, pregnancy does increase the risk for severe illness should you have an infection with COVID-19 while you are pregnant. You're more likely to be hospitalized, receive critical care, such as ventilation or admission into the ICU. It actually has also been found to be an increased risk for preterm birth infants. So just some formal kind of things that are flying around the news regarding vaccination for COVID-19. Let Kelly jump back in.
Yeah, so as I mentioned at the beginning, we every 3 years we do a community health needs assessment with our hospital partners, Healthier Together, Pierce and St. Croix counties. Some of the work that we enjoyed as public health professionals before the pandemic hit. We do have a solid group of a steering committee and leadership team that is going to work to make sure our health assessment gets done in line with all of our hospital partners' needs. So we encourage everyone and anyone living or working in St. Croix County to take our survey. It's part of the assessment. It isn't the entirety of the assessment. We like to hear from individuals to and encourage them to take our survey.
That wraps our presentation up for the day.
Any questions, comments, concerns? Dr. McGinnis.
Yeah, if I can just comment, I think that to highlight the point that both Kelly and Ellie made is that this is a different type of a pandemic. It has changed remarkably in the last month and in ways that are really, really concerning to me as a physician, both for the community and for the county. The potential spread of this thing is much, much greater by a couple orders of magnitude. The risk to those who are unvaccinated is clear and severe. If we had not been able to vaccinate the population as we had over the past number of months, that curve would look at least as bad as November, if not significantly worse, just on the basic mathematics. And so also this pandemic seems to be moving more rapidly into our pediatric population, which last year's did not, which was unusual for a respiratory type of a virus. Usually they move into the pediatric population and spread through that population. But this one appears now, this new variant and the changes we're seeing appear to be involving that population, which makes me really, really concerned about the onset of the school year and where things may go from there if it gets loose in the schools. The 40 will be a very small number, unfortunately. And while it doesn't tend to be as damaging in kids, it still can damage kids. The risk is a little bit lower, but the risk is nowhere close to zero. And for a population that has a lifetime ahead of itself and also that is dealing with something that at this point has lots of ways to control it through vaccination, through masking, I don't find much risk, if any at all, very acceptable in that regard to those children. And then back into our communities, because that's one of the ways these respiratory illnesses can spread. If they get loose in the schools, they just explode out into the community. So it's worth paying very close attention to this, because this is not good.
Thank you. Anyone else? Seeing none, Kelly and Ellie, we thank you for your work. Thank you for your presentation. And Kelly, please pass on to staff our thank you for all their great work. It is greatly appreciated. Thank you.
Will do. Thanks.
And we'll move on to item number 2, which is the proposed rate increase for the St. Croix County Healthcare Campus. Bob.
Thank you, Mr. Chair. I believe Sandy is going to give a presentation if she is online.
Sandy, you're on. Take yourself off mute, please.
Oh, yep, I need that sign, sorry.
That's okay.
It really won't be a presentation. However, I will talk a little bit about the health center rates. Last year, we did not make a change in our rates. I think COVID and a change in leadership, we just totally forgot to present a rate change. And the other area facilities rates range from $296 to $325 a day. And I'm asking that we raise our rate to $295. It was $275. And in Kitty Roads, I do have one correction. We did raise to $387 in 2019. I am asking for an increase to $416. Stabilization and crisis is in Kitty Roads will require additional staff and services. So with that said, I'm looking at those two increases in our rates. Does anybody have any questions about that?
Am I reading it correctly when it says the monthly individual services rate would go from $18.50 to $38.50? Or am I just misreading that?
No. Let me explain that. So the monthly rent in Kitty Roads for just memory care is $3,304. The individual monthly service charges are rated on the amount of care a resident requires from our staff. So there's an assessment. Based on the assessment, they're rated in level 1, 2, or 3. And it goes from $18.50 because residents in memory care or tenants in memory care, as you can imagine, take a little bit more direction and care needs than somebody in a frail elderly situation. And up to $38.50 is a max that we charge for the care and services. So it's for the care needs of the resident. Does that make sense?
Yep, thank you.
Care rate. You're welcome. And that's not changing. It's just this crisis stabilization services that would be changing.
Greg?
How do these rates compare to other facilities around the area?
For the health center, the other area facilities rates are $296 a day to $325 a day. And in the stabilization area, there's not a facility that does that. So it's difficult to compare. I know that Faye might have some information on Trempolo about maybe what the charges are there per day, but it's much less than the 416 or much more than the 416 a day. And these the rates initially were established by Larry Lester when we had him do the performa, and it only went out to 2020. So kind of guessing our best after that.
Anyone else? Natasha?
Can you just describe the crisis stabilization services? Is that a short-term, I mean, I would assume, but is that usually like a short-term type of service then?
Yes, it would be a short-term stabilization up to about 60 days is what we envision. There are some people that may need to stay longer than that, and then they would be returned to a lower level of care or their previous facility, such as if they were in a group home, or if they were at home, they'd come in, we'd work with them, stabilize their behavior, and then move them on to or back to their previous facility. It's going to be for people with dementia, and that is a service that's very needed in the area because of the Helen EF rule, which does not allow people with dementia to be in a psychiatric type based unit. So this is something that we're looking at providing in the community because it's very underserved at this time.
Okay, thank you.
Any other questions? Ken, do we need a motion to accept the rate increases? Can we take them all in one shot? Is there a motion to accept the 2022 rate increases?
I would move to approve the rate increases for the St. Croix County Health Center and Kitty Roads Memory Care Center.
Is there a second?
I will second that.
Got a motion and a second. Is there any further discussion? Seeing none, all in favor say aye.
Aye.
Opposed? Motion carries. Thank you. And we'll move on to item number 3, which are their monthly financials. Faye?
Okay. The financials are included in the board packet. Ken will have them up on the screen for us. Just looking at the HHS overview, you see the, in the remaining balance on the state health grant, that's primarily our public health grant, and that's again additional funds that we've received to cover a lot of the LTE staff that are doing the contact tracing and the vaccination clinics that are going on right now. Other than that, on the next page, our purchase services, you can see if you compare this year to last year, we're higher than we were at that time. We're at 50% of our budget. And I'll kind of speak to those again when we get to the end, when we have that summary page, but I do want to point out that our purchase services are trending a little bit high. I think I'm going to skip all the way back to the health center campus. We don't really have, there wasn't anything really to point out in the the other departments at this time. So with the health center campus, they are continuing to show a negative fund balance. The residents are low right now. A lot of that has to do with staffing that Sandy's working on. We have short-term people just coming in for very short stays. So she is working hard to increase the admissions in long-term care between Orchard View and the health center campus. As she talked about with Kitty Rhodes, they do have the rate increase, and she's looking to get staff hired so that they can provide that service. Waiting to see again what happens with COVID to make sure it's appropriate to open it up. Veterans services at the end, you know, they stay right on track. Phil does a great job with providing the services, you know, for the indigent, the direct relief, and then providing that, you know, to people as they need it. He has the state grants that cover a lot of his services. On the very last page, just our purchase services. At the top, you can see that trend for behavioral health. We had that huge increase in May. That was a lot of Winnebago expense that kind of dropped back down. And that just varies as the needs come up of the people that we're serving. Children's services, although they tend to be had a little spike there in April and May, they are back down running around 160,000 a month. And then just for your information, the July will continue to increase, so that's bills that we're paying here in August for expenses that were incurred in July. So just as an FYI, that number will continue to change throughout this month, and then we'll see that again next month. Will be finalized. So not a lot of interesting things going on right now. We're working on budget primarily, so that'll be coming to you soon. But otherwise, any questions for me right now?
Questions or comments? You're keeping us in good shape, young lady. Thank you. We
I try.
appreciate that.
You're welcome.
Keep up your good work as well. And we'll move on to item number 4, which is a review of information regarding housing needs in St. Croix County. Bob, do you want to start us off?
Well, I think thank you, Mr. Chair. I think I'll turn it over to Supervisor Ard, who's provided some information for us. If that's okay, Scotty.
All right. Thank you so much. Good afternoon. In presenting this report, I won't be presenting it as a county supervisor. I'll be presenting it as the housing navigator for the Salvation Army of Western Wisconsin. In your packet, you have a copy of the slides. We do not have accurate numbers on this, given that we did not have access to the current census information and data. However, the numbers that you are going to see are as close as we can come in proximity given historical analysis. Looking at the 2010 census population for St. Croix County at 84,345 and the 2021 Department of Administration population estimates at 93,150. Please keep in mind that when we are doing population estimates or census, this does not always include the transient population or persons who are coming and staying in St. Croix County for a short time or completely off the radar. And many of those persons are served by the homeless shelters, and organizations within St. Croix County. Currently, single-family home units as of 2020 totaled 39,266. Looking at a base review of permits, we can plus or minus that about 200 units. A median single-family home cost, $299,000, 15% up from 2020. We are just beginning to see the market in single-family home purchases slightly move in a downward manner, but those are primarily older homes built in the 1960s and 70s. They don't have a great section of the market share, and so analysis looks like we're going to see prices to continue to trend up on newer homes. Anything built from the mid-90s forward or any new construction, we're still going to be looking at homes starting in about the $300,000 range for a single-family home. Generally, that would be 2 to 3 bedrooms. Public housing authorities throughout the county, we have a total of 123 units. Please keep in mind that public housing authorities serve persons aged 65 and older or disabled. And disability must be proven. They have to have documentation of a disability. In public housing, those units are 30% of a person's income, which is generally SSI or SSDI. They do come under income restrictions, and so therefore assets which an individual may have must be spent down in order for them to qualify for public housing. Assets cannot, generally, in public housing authorities, you cannot have more than $2,000 in assets. Utilities are included within those units. However, in some public housing authorities, there may be an additional $20 to $25 charge for air conditioning during the summer, as most of these units that we currently have are older, built in the 1960s or 70s. They do not have central air conditioning units. Workforce housing units, otherwise known as Section 42, we currently have 36 properties, 1,117 units. Those range in unit size from efficiency to 3-bedroom. There very rarely is there a 4-bedroom unit. Currently in the city of New Richmond, Girard Corporation, in cooperation with WIDA, Decker, and Bremer Bank, are producing a 42-unit Section 42 housing complex. This is going to start taking applications in September of this year. It will open for occupancy in December. This will help to relieve some of the pressure that has been put on Hudson and New Richmond as far as housing with restrictive incomes. As we move down the list, we see that efficiency 3 and 4-bedroom rentals are the highest in demand because we have the fewest of them in the county. At the time when most of our apartment buildings were constructed and designed, which ranges from the 1920s to the 1970s, you did not have families living in apartments where you needed 3 and 4 bedrooms. Most persons who lived in apartments were single, or they were a newly married couple. Our entire occupancy status and style has changed. We have many more persons living in apartments. Land is becoming at a premium, especially in metropolitan areas. And so we start going up rather than spreading out in single units. Efficiencies were not, this is a rural area, so efficiencies were not looked at as something that was needed. So those are the 3 top priorities, and they're also the 3 highest sought out apartments in this area currently. A wait list average for a 1 or 2-bedroom apartment is currently 60 to 100 persons. Applications per units available average 30 or more, and the apartment is usually rented within 2 days. Barriers to housing, and this is a big one that persons normally don't think of because for those of us in this room, we may never have had these. But criminal history, prior evictions, and credit score. Now, although it is illegal in the state of Wisconsin and most of the United States under fair housing, certainly federally under fair housing, but under our state statutes, to discriminate against anyone for their criminal history. Property owners are never to use CCAP as a means of vetting a possible tenant. It happens all the time. And there is no way that you can essentially stop it, because CCAP is available to anyone. Unfortunately, even in the appeal process, it becomes a barrier. Criminal history, especially if it is drugs, will bar someone from housing. That is in public housing, in any Section 42 or federally based program. If you have a conviction for methamphetamine, if you have a conviction for distribution, you're not going to qualify under their selection criteria. And appeals can be written, and given the amount of time that you may have been sober, if you have 10 or more years from that charge date, you may get lucky. But there is nothing that requires that a person who has any type of drug conviction, there's nothing they can do regarding the denial of housing. When we look at integrated housing is a source of housing which addresses, for the most part, AODA, drug issues, and mental health. We currently do not have any such housing developments in St. Croix County. If we look at Milwaukee, Madison, Racine, further to the southeast, we'll see that there are a number of complexes in which the entire building, made up of 1- and 2-bedroom apartments, is completely service on site for persons who are facing these challenges. One of the greatest issues that we have in housing is that persons who are facing drug, alcohol, or mental health issues often cannot stabilize themselves, and they do not have immediate services to come to their apartment to help stabilize them, so they go into a spiral. And that's when damages occur and property owners say, I've had enough. And then the eviction starts and they're on the street. And this is one of the biggest issues that we face. And in St. Croix County, the number of persons who are facing these challenges is significant. You pass them on the street every day. You walk by them in the grocery store. You'll see them in the parks. You cannot recognize it because they're not wearing a sign. Many of them do not look disheveled. They look just like you and I. But they are in crisis, and they cannot hold housing. Even though the CDC has continued the moratorium until October on evictions, it is a very narrow scope. Most persons will not qualify for eviction protection, and evictions have already started within St. Croix County. Most of those evictions that I'm dealing with currently are persons who have AODA, drug, or mental health issues, and they are being evicted on behavioral issues, which is not covered under the eviction moratorium. So, next slide, please. Fair market rent is the rent which is published by HUD every year. As you can see, this is the fair market rent for St. Croix County. Because St. Croix County is an extension of the Minneapolis-St. Paul Bloomington area, these rents are calculated using numbers from both St. Croix County and from the metropolitan area. So as we look from 2019 to 2021 to 2022, we see how the rents have raised. However, if you can get an efficiency 1, 2, 3, or 4-bedroom, if you can find those in St. Croix County at that rate, it would be phenomenal. And if you do, let me know right away. But this goes out throughout the country. Every state, every county, every parish within the United States receives an FMR. And that informs everyone as this is what is the fair market rent based on your population, based on your median income, based on unit. And they have a very complicated calculation that they come up with this to present it. So these are what the rents, we'd love to see rents at this amount in St. Croix County. It may not happen. Next slide, please. Now you are looking at the 2021 average market rate rent in St. Croix County. Market rate is generally privately owned or corporate run. It receives no federal or state subsidies. The owner is not mandated by any means to restrict rent. They can charge as much as the market will bear. So currently what we are looking at, a studio apartment has an average rent of $1,217, the highest rent at $3,536. When you look at the cheapest rents, $450, $525, $750, $1,065. Most of those rents are in program-based or subsidized housing that have now run their contract, which is generally 15 to 30 years, and they are now open on the market. Most of the buildings have had very little upkeep, maintenance, or modernization. The property owners who have now finished with their tax credits do not invest anything in the building, and so they will rent basically to whomever would like to live there. From a habitation perspective, are they habitable? Absolutely, they're habitable. Would they pass a HUD, housing quality inspection? No, they would not. But by all codes of health and safety, those buildings are safe and the domiciles within them can be habitated. Next slide, please. Rent-to-income calculations, and you'll see this a great deal. When property owners are looking for rent incomes, you'll often see in their ad 3 times the income as to what the rent is. We have very few persons who are renting in any of the units in St. Croix County who actually make the amount of money required for that rent. But what they will do is they will take 40 to 60 to 75% of their income to pay rent because we are at such a low stock of available apartments. And so persons are literally doing whatever they can to find shelter. So when we look at a $1,000 rent means you need to have a minimum of $40,000 income to afford that rent. And this is not including utilities. So we have a great gap between what a person's monthly income is and what they are paying out in housing. And currently, St. Croix County has no one in the market share who is paying 30%. Everyone is far above that. That makes me very nervous because when people are paying 40 to 75% of their income, it only takes one crisis to put them into deficit. And then we're looking at persons who, it just goes from one to another. They can't make the car payment. They have a medical issue. Now the medical bills are piling up, even if they have insurance. One leads to another. So our rental housing cost is far too high for what persons are actually making in this county. Next slide, please. These are the 2021 poverty guidelines for the 48 contiguous states. When you look at these amounts, so going from a one-person household at $12,880 to an 8-person household at $44,660, you're thinking we can't possibly have anyone living at this standard in this county. Actually, we do. We have many thousand people living at this standard in this county. And it's not just persons who are retired and receiving Social Security insurance. We have families who are living on less than $12,880 a year. So these are numbers that we have to take very seriously and start addressing what can we as a county do to help persons get into housing and stabilize incomes by having rents and having affordability in housing for what they are making. And it is a huge challenge. Next slide, please. Let me get back down here. Okay, what we are looking at now is from the HUD, Housing and Urban Development. This is a scope and outline of St. Croix County for 2021. Median income, $104,900. When we look at the fiscal year income unit or limit category, when you look at this, this means that when you are in the very low income or 50% of the income limit, One person is $36,750. Not bad, it's doable. You get into extremely low income at $22.50, and then low income, which is 80%. There's just, people can't survive on what these income limits are. And we see it every day. When you speak with hospital billing about how many people are in default in medical billing, it's tremendous. They can't afford medical bills. We have persons right now, the sign-up for the Shop with a Cop program is loaded for bear in St. Croix County because people can't afford school clothes for their kids. They're stretching dollars, doing everything they can, but their biggest cost is housing. So the final slide is just information to kind of give you an idea of some of the terminology within housing. But right now, there's not a great deal that we can do. We can't go to private owners and say, oh, you need to lower your rent because we want people to be more financially stable. That's not going to happen. Rental properties are a business. The Section 42s, the 202s, the housing choice vouchers, the emergency housing choice vouchers, those are all available, and that's fantastic. The problem is that you have to meet a certain income requirement, family number requirement, and a homeless requirement in some cases in order to achieve that. In this county, our greatest efforts can be put into speaking with developers, speaking with agencies such as WIDA, bringing people together just as Paramark Corporation, Girard, along with WIDA, Decker, and Bremer Bank, are building those units for Section 42 in New Richmond. Our greatest need in this county is for low and low-income housing. That is where the greatest need lies. And just to give you a little bit of extra numbers so that you have an understanding of how the shelter has assisted St. Croix County with homeless. In 2020 to 2021, 394 individuals and families were served by Grace Place. That accounted for 15,446 shelter nights. We served 25 people, individuals and families, which accounted for 166 motel nights. Now, some of those were due to evictions. Many of them were due to COVID quarantine because they had no place to quarantine. We have 24 permanent supportive housing units, which are scattered sites operated by the Salvation Army in St. Croix County. Those units deal with individuals and families. All of them have critical mental health issues. They have case managers who visit them weekly, and they have emergency contacts should an event occur. But it's not enough. This is where we need to start focusing. Once we stabilize mental health, AODA, alcoholism, drug abuse, we start stabilizing our communities as a whole. The monies that we spend in law enforcement, emergency medical services, emergency room visits, persons continually going to the emergency room rather than the clinic because they're in crisis. Once that is stabilized, we see a significant savings to the county, to the municipalities, and we see families and individuals stabilized because they're in housing that they can afford, that they have case management so that they're not isolated, and then we start moving forward, moving them back in as productive persons in society. And some persons will never be able to be productive in society because their illnesses or challenges are too great. But at least they are safe. They're not on the street. They're not continually going through a revolving door in the judicial system because they keep breaking the law, not intentionally, but most of the persons who get picked up on a mental health, AODA, or drug, because they have not received services and they do not have stabilization. Stabilize them, and you see a change, and a positive change. So, any questions?
Questions or comments? Greg?
No, I'm referencing back to the first slide. Is the distribution of those units same as the population distribution in St. Croix County? Or where are these units sitting is there a map that shows where they're sitting?
Which units are you speaking of?
All of them on that first slide.
They're throughout St. Croix County.
I mean, is there more, I assume there's more in Hudson than there is in Glenwood City.
There's more Section 42 units in Hudson, certainly.
Right, but I'm just curious what the distribution looks like.
It's scattered.
Yeah.
And
I mean, are there...
Hudson dominates St. Croix County
Right.
in the Section 42 housing, just as it does in Senior 202 housing. It's a larger community, it's a border community, and developers have built heavily within Hudson.
I mean, what does Baldwin look like? I'm just curious.
Baldwin, I believe, and don't quote me on this because I don't have my tax in front of me, but I believe Baldwin has 3 Section 42 properties. There are 15 to 20 units. They do have a public housing authority. I can't tell you what the exact count on the units is, but if you'd like that information, I can get it for you.
I'm just curious what the map looks like.
It doesn't look great. The further east we go,
I understand.
the less.
I believe,
Yeah.
I can visualize that, but I'd just like to see what the distribution really looks like.
I'll get that ready and have it for you the next meeting.
Okay.
Deb?
I was just wondering, is the new Section 42 property in New Richmond, is that the building that's going up on Dakota Avenue there?
It's on South Dakota and
South
West
Dakota.
6th.
And how many units will there be there?
I believe it's 42.
Okay, just curious. Thanks.
Do you have any other questions?
I have a
Yes,
couple.
Dr. McGinnis.
Dr. McGinnis?
Sorry. You mentioned for some of the housing that you 65 are disabled, the disability, is that require an SSI level type of certification, or are there other avenues?
Generally, it would be an SSDI certification, especially if it's a younger individual. There have been cases, and it is completely up to the housing director as to whether they want to accept, say, a doctor's letter of disability, explaining disability, or and whether that's a psychiatrist, psychologist, it could be a physician who states that this person has significant atrophy in their right leg and is going through a disability case. So applications are reviewed quite thoroughly by the public housing directors, and certainly in cases such as that.
Yeah, because some of the disability cases can take quite a while to move through the system. Years.
Yes, they can.
And, my second question is, you mentioned the integrated housing, which I think strikes me as being having a lot of utility, because you get these people in their spirals, and they've done one thing, and then they get, it just keeps going and going and going, and there's just never a ladder they can climb out with. So the integrated housing, do you think that that's something that would be worth considering or viable within St. Croix County? Has the model been developed well enough to look at it as a viable alternative?
I think when we look at integrated housing services, especially those that are in Milwaukee and Madison for the state of Wisconsin, Minnesota has a phenomenal program within integrated housing. I think the model in Wisconsin has been developed well. If I were going to attempt to do this in St. Croix County, I would probably follow the Minnesota model because it allows for stabilized housing, the provision of services for those persons, 24-hour staffing, which does not mean that you've got a person on every floor who's running to each unit all night. It is, you have a desk staff who is there on overnights should a crisis occur. You have an immediate crisis response team who's dealing with that individual as fast as an ambulance could respond. And that's what makes it so successful, because you have professionals dealing with a drug and alcohol or a mental health crisis immediately, not 6 hours later but immediately. And that allows for de-escalation, for calming, and for the inducements of meds if that's necessary. I think that this is something we are constantly talking about taking people down, and they're going in for a 3-day mental health hold. For the amount of money that we've spent on that, we could have had several units of housing. But it all takes time, and it takes very critical it takes a great deal of critical planning to make this work. I like the models in Minnesota because there is access, immediate access to services 24 hours a day. So whilst you've got persons who are stabilized, and I believe it is in the Minneapolis development that they are adding the crisis care center. So if you are on the street, you can walk in, almost like an emergency room, 24 hours a day, and you can receive services for your mental health, AODA, or drug challenges on the spot, immediate, and then receive your referrals, and you're getting into programs that you may not have known existed.
My comment is that strikes me as a much better way of starting and kind of getting to some of the root cause. I think about my time in the ER and the people who would continually return for services over and over and over again, and you'd have your 3-day mental health hold. They'd be taken over to Oshkosh, and then they would come back, and then it all starts over again because they don't have the resources and the other pieces of the puzzle they need to get stabilized, to get the feet back underneath them, get that month or two of just getting life put back together, that then they can go out and begin to develop a stable relationship with a work environment or something else. I also think about the number of times in the emergency room that we were doing mental health services, drug services, alcohol services that, is not the primary focus of what the ER docs and the nurses are trained to do, that there are much better people to do that. They can probably provide it at a lot lower cost than an ER. ERs are horribly expensive. And so I look at something like that because those are the folks you see just back over and over again. Law enforcement knows them by name, the ERs know them by name, but they just keep spinning in the system. And as you mentioned, and I totally agree, costing the system a huge amount of money if we get down to that piece, but then also just causing a lot of other issues and snowballing issues within systems.
And that's just it, because regardless of what data you look at, once a person is stabilized in housing and has ongoing services, we find that we don't see the fallout. We don't see them failing. We see them succeeding. So with a less than 3% failure rate amongst persons who are in integrated housing, that's significant. And whereas we may not be able to provide integrated housing for every person who needs it at the time, it's the expansion of services and addressing the drug, the alcohol, and the mental health issues in as immediate a circumstance as is possible, and getting persons into service, getting referrals to get them into stabilized housing, even if it's not integrative, but getting them into stabilized housing, that will make the difference.
Any other questions? Hold on.
It's not a question, it's just that was an excellent presentation. I don't feel any better. Other than I will assign Supervisor Ard to be in charge because she really gets it and it's really a problem. So thank you.
Thank you.
Anyone else? Greg?
When do we start doing this, integrated housing? Are we just going to talk about it and let it die, or can this be on the next agenda? And how? Let's start doing something instead of talking about it. And because we're in the metropolitan area, let's be part of the metropolitan area and do what they're doing.
Bob?
Yeah, and I agree with that. And we have started those efforts. I think one thing I would like to mention about Minnesota was we made an intentional and sustained argument with the state of Minnesota that housing should be included in any healthcare discussion because of the very reasons that Dr. McGinnis and Supervisor Ard pointed out that the cost savings down the road and the healthcare improvements down the road were obvious in the data. So we had to, over a period of years, convince the state that spending money on housing was a wise investment for healthcare, and it proved to be so. But because of that, then the state dedicated a significant funding stream for people leaving residential mental health and addiction treatment facilities. They provided 90 days of housing support for anyone leaving those facilities to stabilize them and get them into longer-term housing, which was really beneficial. It was also a part of the behavioral health urgent care that I believe Supervisor Ard was referencing in Minneapolis, that accepts people with any behavioral health condition brought in from law enforcement or that just walk in off the street. Takes them from that point, and that person then becomes their responsibility to find housing, to find mental health or addiction needs, or whatever the employment help, whatever the need might be for that person. It works quite well, but it's hard to fund. It was a partnership between health plans, hospitals, county, state government, and federal government grants. So it wasn't easy to put together, and it's not easy to sustain, but the idea is sound. And I think some of the things, just the last thing that I'd say to this is the ARPA funding that we requested through HHS, those interventions that we listed on ARPA funding were intended largely to serve populations in other settings and to build healthcare relationships with these individuals so that they're not dropped off after 3 days or let go of in terms of service delivery after a short period of time, but that we're sustaining that relationship with them, helping them get employment, finding employment assistance, helping them with housing assistance, helping them stabilize through supporting recovery housing and other kinds of environments, and addressing those barriers that Supervisor Ard mentioned, like criminal histories and low credit scores and things of that nature. If we can, human services can support people in those environments over long periods of time through peer support and care coordination and that sort of thing, we stand a better chance of providing a meaningful safety net that prevents people from falling into crisis. It takes time to build that, and it takes time to build the funding, sustainable funding that will support that. But that's what we're trying to do with a lot of these ARPA dollars, and that's what we're trying to do anyway philosophically, and hope, and to measure the outcomes and hope that we can show to funders like Medicaid in the state of Wisconsin that we can lower healthcare costs and improve outcomes by doing these things, even if there's an upfront cost or an ongoing charge, to provide the service. But it's no, and last thing I'll say is it's no mystery. I mean, the Affordable Care Act was based on this concept that if we provide these kinds of supports, people will do better over time and trend in a healthier direction. It's something that data shows. It's something that politicians oftentimes don't want to invest in if the payoff is 5 years down the road. So we have to look long term, But I couldn't agree with you more, Supervisor Telejohn, that we have to turn it into action, and we have to pilot things, and we have to measure outcomes to see if we're being effective. Thank you for the presentation.
I realize it's a long-term, effort, and if we don't start now, it'll still be longer term. So I think we need to start tomorrow.
To be honest, research has already started into funding mechanisms for just such a development. And it's a matter of identifying those funding mechanisms through the federal and state government, through private parties, and bringing together the developers. And there are many companies, such as Girard Paramark Corporation, that is their goal, is working with integrated housing. Cardinal Capital is another company. They actually own and manage the integrated housing, which is in the city of Milwaukee. And there are 7 integrated housing models comprising almost 1,000 units of housing in the city of Milwaukee. So that research is underway, and It will be about bringing people together for conversations and looking at what will be the most effective and efficient funding mechanisms to put this together.
I'd like to see this as a recurring agenda item from now on.
Anyone else? Well, I'll tag along, Scotty, and this is some great information that you brought forward. You're doing a great job in the work that you're doing. We greatly appreciate that. And board members, it's been a good conversation. It's a good starting piece, and we will be moving forward with it. So thank you all. With that, I'm requesting any future agenda items. Yep. Anything else right now? Seeing none, announcements and correspondence. Bob?
I don't have any announcements that I prepared. Thank you.
Okay. Anyone else? Ken, you have anything to add? Adam? With our PIO, you're helping us out with a lot of stuff, and we appreciate all your good work, too, for getting that information out. Our next meeting will be September 15th at 5 o'clock, right back here, and our meeting is adjourned. Thank you, everyone.